Thank you for joining me for the Wellness Way approach to thyroid health. My name is Dr. Connor. I'm one of the 4 doctors here at the Wellness Way Sarasota, and we specialize in treating people with all sorts of chronic illnesses, whether it's thyroid dysfunction, hormonal imbalances, gut health dysfunction, anything that may be bothering you from a chronic standpoint. We're here to help you kind of overcome that and get your life back. If you're watching this specific video, chances are you or someone you know has been dealing with thyroid conditions. Maybe you've been told your thyroid is normal, but you still have all the symptoms of thyroid dysfunction. You've had blood work run and you told you were hyper or hypothyroid. Maybe you were put on medication for that, but it didn't help. Maybe you explained your symptoms to your doctor, they gave you medication, but they didn't run into your labs, or your labs look normal. So I'm here to kind of walk you through how the thyroid works, what our traditional approaches are for it, how we can work to kind of resolve some of those thyroid issues that are going on and help you get back on track with your health. So before we can talk about the thyroid, we've got to talk about the different areas in the body that the thyroid functions and what some of those possible symptoms are going to be of thyroid dysfunction. When we think of the thyroid, there's a lot of things that can happen because the thyroid is involved in almost every cell in your body. And unlike a lot of other hormones where the body produces the hormone in a certain gland, that hormone travels through the bloodstream and then acts on another area of the body, binds to the cells and creates a change. The thyroid hormone works a little bit differently, which is why it has such a dramatic effect on the whole body, not just individual areas and individual cell types, right? So what the thyroid hormone actually does is it travels into the cell, through that nuclear membrane, actually binds to areas of DNA that increases the transcription of certain protein genes. Those proteins then go to different areas of the body and have a lot of effects. One of the main areas is metabolism, which is why a lot of times when we think of a thyroid dysfunction, we associate it with body weight, right? So one of the most common signs of hypothyroidism, or one of the reasons that you may think you have a thyroid issue, is because you can't seem to lose weight. And for a lot of our patients, there are actually thyroid issues going on, and that's the reason they can't lose weight. And so that may be one of the big things. But as you can see, we've got a whole lot of space left under there, which means there are a lot of other things that that thyroid is going to be doing as well. So things like breathing, heart rate is another big one, heart health contraction. We've also got cholesterol levels. So as we have moved further away from that normal cholesterol range, further away from normal thyroid levels, those two are going to play a big role. So for cardiovascular health, thyroid function is very important as well. It also controls our central and our peripheral nervous system. So as chiropractors, we deal mainly with the nervous system. So this is something that we see a lot when we're struggling, trying to overcome certain different neurological things. The thyroid may sometimes be involved in that as well. We also look at muscle strength, menstrual cycles. So for females, a lot of times we're going to struggle with the menstrual cycle. Now there's a lot of other hormonal issues, but as we'll talk about a little bit later in the presentation, hormones for females are very closely related to thyroid function. So specifically looking at estrogen levels in females, that's going to play a big role in how the thyroid hormones are actually functioning within the body. Body temperature, too hot or too cold, digestion as well. Bone health, calcitonin, calcitriol, both hormones secreted by the parathyroid, which is right behind the thyroid, so we can play a role in bone health there as well. And then development and IQ. So for kids especially, if our kids don't have normal appropriate thyroid hormone levels as they're developing, that brain health may actually start to suffer as a result of that. And the last one is the immune system. So yes, the thyroid is very important for promoting normal immune function as well. So we break this down, the two most common, or the most popular, or not popular, I guess, the most common type of thyroid dysfunction is going to be hypothyroidism, which is where we don't have enough of that hormone being produced, or we don't have adequate levels of the active hormone circulating throughout the body. So main symptoms of hypothyroidism going to be things like trouble sleeping. Now we're going to notice a lot of these symptoms are similar between hypo and hyperthyroidism, which is why it can be kind of complicated sometimes when we're trying to decipher what's actually going on. So with hypothyroidism, that sleep issue is going to typically be a difficulty falling asleep. On the next slide, we'll talk about hyperthyroidism and some of those symptoms, and we're going to see that that's actually a difficulty staying asleep versus with hypo, it's just that difficulty falling asleep for trouble sleeping. Now, because of that, we're also going to tend to have tiredness and fatigue. Part of that is a lack of sleep. Part of that is also because a lot of our metabolic processes are going to start to be slowed down when we don't have enough of that thyroid hormone. So thyroid hormone goes into the cells, binds to the DNA, creates new proteins. Those proteins then go and do specific things within the body, and those are going to increase pathways, so increasing that metabolism. So most of our hypothyroid symptoms are going to be related in some degree to another to slowing down. So trouble falling asleep, that tiredness, that fatigue, difficulty concentrating, that goes along with that as well. The dry skin and hair. So with the hair, again, here's another one. We're going to see hypo and hyper symptoms all have hair issues. So with hypothyroidism, that's going to be your hair falling out in chunks. So you look at the shower drain, it's full of hair. Looking at your comb, just the hair just falling out more than a normal amount. A lot of times that can be contributed to hypothyroidism. The other one is going to be that outer 1/3 of your eyebrow too. So if you're looking in the mirror and you start seeing those eyebrows thinning from the outside, oftentimes that can be related to thyroid dysfunction. We've also got depression. So depression, again, slowing things down. Constipation, slowing down digestive function, sensitivity to cold temperature. So if we don't have a fast metabolism, we're not going to be creating that body heat, so we go out into the cold and we really struggle to regulate our heat as a result of that. Frequent and heavy periods. So like I said, menstrual cycle, we have issues with menstrual cycle with hyper and hypothyroidism. In the case of hypothyroidism, it's going to be those really frequent and heavy periods. And again, that plays into your hormone function as well. And then joint and muscle pain. So we kind of flip the script for hyperthyroid symptoms. Hyperthyroidism, again, trouble staying asleep. So there's still sleep issues. We have the restlessness, the rapid heart rate, the anxiety, the irritability. So kind of the exact opposite of what we saw before. The sweating, tremors instead of constipation. We've got the looseness in the stool instead of weight gain. We've got weight loss, weakness. This is thin skin and hair again. Instead of hair falling out in chunks, it's going to be more of that really thin and brittle hair. And then heat intolerance, because our metabolism is constantly going, we're producing a lot of heat. So if we're in a hot area, we're going to struggle with that, struggle with sweating, things like that. So as we can see, it can be very complicated here trying to really decipher what's going on with the thyroid. And these symptoms can be caused by a lot of other things as well. So we talk about sleep, we talk about heavy periods, we talk about weight gain, heat intolerance, hair issues. There's a lot of things that can cause those exact same symptoms. That's why it can be kind of confusing sometimes when it comes to thyroid symptoms. Is it a thyroid issue? Is it something else going on? Do we have multiple things going on? And that's really what we're going to dive into today, is how can we start to decipher where these problems are coming from. So before we can kind of walk through that process, we've just got to lay the groundwork for kind of what our philosophy is in our office and how we do things. So we're going to start with the fireman carpenter principle. This is our foundational principle of what we do in our office versus the medical system, right? So we're not treating diseases, we're not giving medications, we're looking at things completely differently. And it's going to kind of make sense after we talk about our fireman carpenter principle here. So imagine you come home, pull in from a great night out, pull into your driveway, and your house is on fire. You've got to think about what's the first thing most of us are going to do. And if you're anything like me, you're probably going to pull out your phone, you're going to call 911, you're going to call the fire department, right? Firefighters are going to show up to your house, you're going to have a couple guys jump out of the truck. First guy's going to run up to your house with an axe and he's going to start chopping in that door, right? Second guy with his fire hose is going to run in right behind him and they're going to start spraying water everywhere. So they're going to be spraying water all over the couch, the walls, the pictures, the kitchen, the bedroom. And is the water good for any of those things? And the answer to that question is no, right? Water is not good for our walls, it's not good for pictures, it's not good for the carpet or the couch. But in this moment right now, when our house is burning down, do we care if the water is good for any of those things? No, right? Who would care about that? The main goal right now is to make sure that our house doesn't burn down. Because if the house burns all the way to the ground, there's no rebuilding it and there's no saving anything, right? So fireman does their job, they put the fire out, and then they're standing in front of your house. It looks like this. You walk up to him, you say, hey, Mr. Fireman, can I go back into my house? I need to grab a couple things. You know, the bedroom's still safe. I want to stay in the bedroom for the night. They're going to say absolutely not, right? Because this house is a toxic wasteland. You could get injured, you could get hurt, you could get killed if you go back into that house. So they're going to say no. So you go stay at a friend's house, you stay at a hotel. Next morning, you come back. Now who are we going to call the next morning, right? So fire's out, house looks like this. Next morning we show up, and most people will say they're going to call the carpenter. Really, most people say they're going to call the insurance company, but the reason we call the insurance company is so they can pay for the carpenter to come out. So carpenter is going to come out, he's going to show up, he's looking at the exact same house. So now we've got two trained professionals, both of them looking at the exact same situation. The fireman with his axe and his fire hose is looking at this house and saying, what a great job I did, patting himself on the back, put the fire out, save the house. The carpenter looking at the exact same house is thinking, what a mess. I'm going to have to go in and gut everything. I'm going to have to bring in new drywall, new carpet, new furnishings, and we're going to have to completely rebuild this from the ground up. So my question is, which one of them is right? And the answer is both of them are right. They're just looking at things from a different perspective. And that's kind of what I want you to understand here, is that this is kind of how our healthcare system is set up as well. The job of the medical system is similar to the job of the firefighter. Their job is to make sure that you're not going to die. If you fall and you break your arm, if you come down with a serious illness, if you have a heart attack or a stroke, that's why we have drugs, that's why we have surgeries, and we're extremely thankful for the fact that we have those things, because that's what's allowed us to live for so much longer. The problem is that once we've established that you're no longer dying, how are we ever going to make you healthy again with a drug or surgery? And the truth is you can't, because no drug or surgery will ever actually make you healthy again. We have to look at what's going on from a foundational level in the body, and how can we work to rebuild that house. And so that's where we come in. So we've established that you're not dying. How can we now bridge the gap between all the symptoms that you're experiencing and where you want to get with that optimal health? And so as we walk through today, we're going to kind of understand a lot more about the way that we look at the body and some of the things that we can start to do with our understanding and our approach to get you back on the right track with your health. So, medical system's approach to health is house caught on fire once, so we're going to stand outside your house every day for the rest of your life, and we're going to spray it down with a fire hose to make sure that if it catches on fire again, we can put the fire out right away. Our approach is we want to go in and say, hey, maybe it was an electrical issue that caused the fire in the first place. Maybe we've got electrical wiring from the 1950s that needs updated so the house doesn't catch on fire again. And then we know the house isn't going to catch on fire, and we don't have to be spraying it down with a water hose every single day. And I'll give you a bonus point for anybody who can leave a message and tell me which house that is. So let's look at hypothyroidism specifically. So if you're watching this video, again, chances are you've dealt with hypothyroidism either personally or know someone that has, or you Googled your symptoms and Dr. Google told you that you probably have hypothyroidism. So this is what the traditional medical testing for hypothyroidism is going to be. And it all starts with a TSH test. So what is a TSH test? A TSH test is used to check the level of thyroid stimulating hormone in your blood. Your TSH level can indicate if your thyroid gland is working properly. While a TSH test is usually used as the initial blood test to detect hypothyroidism, the doctor may need to order additional tests to diagnose hypothyroidism. Now, if you're like many of the patients that come into the office, you have had a couple extra things run. Typically, they'll run TSH. The problem is that they will run TSH with a reflex to free T4. What that means is that they're only going to run your T4 levels, which is your thyroid hormone level, if that thyroid stimulating hormone is out of range. And that can be a problem for a couple different reasons, mainly because you don't just wake up one day and have a disease, right? That's a process that happens slowly over time. And so there's a point where we start having these symptoms, we start having these disease processes taking place. We can tell you're headed down a bad path, but until it gets beyond the disease threshold, that line in the sand, there's nothing that the medical system can do. And that's unfortunately what happens is when we run that TSH with a reflex to T4, we're only going to run T4 if TSH is outside the disease threshold, not outside the functional threshold, not outside the I don't feel good anymore threshold. And so many people, though, have had that free T4 checked. So the doctor may also check your level of free T4 or free thyroxine, which is the amount of thyroxine or thyroid hormone in your blood. It's important to know that blood tests are not the only way the doctor determines your hypothyroidism diagnosis. Asking you how you're feeling is just as important. And unfortunately, I've had so many patients that have come into the office that have told me their doctor gave them thyroid medication without even checking their thyroid levels. They just went to their doctor, said, I'm struggling with this, 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 and this. Doctor said, oh, sounds like that could be a thyroid issue. Here's levothyroxine. Why don't you start taking this and we'll see how you feel. And it's just mind-blowing to me that people can go into their doctor's office and be prescribed a medication without actually having the proper testing done. It's crazy. So this is kind of the traditional medical approach to thyroid dysfunction. We're going to test a couple things, and then if you're low on T4, we're going to give you a medication that's going to take the place of that without any further understanding, right? So that's the fireman approach. We're going to test TSH and T4. So you've had these hormones tested. What's the answer? Well, if you're hypothyroid, you're going to have a high level of TSH and a low level of T4, and the doctors are going to put you on a medication called Synthroid or levothyroxine. This is one of the most commonly prescribed medication in the U.S. right now. I believe it's the second most prescribed medication in the U.S. right now, with 90 million prescriptions a year. There's only 300 million people in the United States. That's 90 million prescriptions to an estimated 20 million different people. So this is a huge, huge problem in the United States. The problem is that levothyroxine is a synthetic version of only T4. Now, we haven't gone into the whole thyroid hormone production pathway yet. We're going to talk about that here in the next couple slides so you have a better understanding of that. But we're missing the bigger picture when we're only prescribing a medication that has T4 in it. Some of the side effects: irregular heartbeat, chest pains, muscle weakness, nervousness, irritability, sleeplessness. What does that list of side effects sound like? And if you're thinking in your head, that sounds a lot like the list of hyperthyroid side effects, you're absolutely right. It's very similar because the side effects of a synthetic version of thyroid hormone is going to create hyperthyroidism, or basically an overprescription. Again, we can see levothyroxine right there, actually 98 million total prescriptions in 2020, and that was to 20,225,000 people. So it's a huge problem in the United States. The other problem in the United States right now is that based on this TSH, T4 testing, based on giving levothyroxine, we see so many people that still don't feel better. And the answer we're going to talk about in a couple slides here is that the problem is not a production issue. So say you fall into the category of, I was given the medication, my symptoms didn't get better, I felt the same, or I got a little bit better, but I still have a lot of other symptoms going on, or in some cases, people just straight up get worse. So you start looking for other options and you find an alternative medicine approach, or the functional medicine approach. Now, what they're going to be actually looking for is TSH and T4, just like the medical approach, but a lot of times they're actually going to add in T3, and they might even look at some of your antibodies. The benefit here is that T3 is actually the active form of thyroid hormone. So if we're adding that in, we're going to see what's actually active to have the biggest effect on the cells. And then we're going to add in antibodies, so we're going to be able to see if there's any autoimmune contribution going on here. Unfortunately, with that medical approach, they're testing more. They're going to get a better understanding, but their answer is still the same. Their answer is still medication. Now, instead of giving Synthroid or levothyroxine, they're going to give typically a desiccated or a compounded version of thyroid hormone. The benefit to that, something like Armour Thyroid, Nature Thyroid, WP Thyroid, one of the desiccated thyroid hormones, is that there's no synthetic dyes. It's going to actually have a little bit of T3 in there, so it's definitely a better option. But is the underlying approach any different? The answer is no. We're still looking at blood work, we're finding a deficiency, and then we're filling that deficiency with a medication instead of looking to understand what's happening within the body. Why is that response happening to begin with? The other option here is that they may give you a compounded thyroid hormone. So they may look at your T4 and your T3 levels and then give you a synthetic version of T4 and a synthetic version of T3. However, that synthetic version of T3 liothyronine typically reserved for very severe hypothyroid cases. So most people aren't going to have had experience with compounding yet, but if you have compounded, that's typically going to make you feel the best. But again, the underlying approach and philosophy is still the same. We're still giving medication to fill a void found on blood work. So this is where the Wellness Way approach comes in. We're the carpenter doctors. We don't just want to look at and say, you're low here, we're going to give you something to fill that gap. We want to understand, why is this happening? What caused it to happen in the first place? And then how do I fix it, right? So how do I get to the bottom of what's going on so that your body can start to function normally again? Because at the Wellness Way, we have this crazy idea that your body was designed to function normal. All it does is adapt and respond to the stresses that you put on it. And eventually, if we continue responding to the same stressor for long enough, we're going to get pushed into that disease state where we're going to start to have all the symptoms and side effects, right? So we don't want to just say we're in the disease state, let's give you a medication to try to force you this way. We want to understand what it was that pushed you over here to begin with, so we can turn this stressor off and give your body what it needs to heal to come back to that normal functional state again. But before we can do that, we have to understand how the thyroid actually works to begin with. And it's not a simple hormone regulation feedback mechanism. So the feedback mechanism of the thyroid starts up in the brain in an area called the hypothalamus. Now your hypothalamus is going to create TRH. So TRH is thyroid releasing hormone. This TRH hormone is going to go to the pituitary gland, and it's going to stimulate the pituitary gland that, hey, we need more thyroid hormone. Pituitary gland is then going to release TSH. TSH is going to go to the thyroid gland, where we're going to release thyroid hormone. So thyroid hormone is going to be released from the thyroid gland as mainly T4. About 93% of the thyroid hormone released from the thyroid gland is T4. The rest of it is T3. Once we increase those hormone levels in the body, we're going to work on a negative feedback loop to then signal to the pituitary and to the hypothalamus that we have enough hormone. We're going to stop the production of TRH and TSH, which is then going to slow the production of T4 and T3 from the thyroid. Now, all of this feedback mechanism is what allows our bodies to adapt to the environment. Now, thyroid hormone is not just a flat line. It has to fluctuate throughout the day depending on the stress that you're putting on your body. So if we're taking a medication one time, first thing in the morning, we're going to have a consistent level throughout the day. Can we then respond to our environment if our hormone's like this? And the answer is no. So even if you're taking the medication and you feel better, you're still preventing your body from being able to adapt and respond to stress the way it was designed to through these adaptive feedback loops here. So we want to understand, why is that feedback loop not working, or where did we have a breakdown in that feedback loop? So where do we need to work to support so that the body can get back to that point where it can start to adapt again? So understanding thyroid hormones. So there's 6 main hormones created by the thyroid gland. Really, calcitonin, that 6th one, is created by the parathyroid glands, which are a bunch of small little glands on the back of the thyroid. For the purposes of today's discussion, we'll just group everything together. But the main hormones produced and actually secreted by the thyroid are going to be T4 and T3. We also have a hormone called reverse T3 in circulation, and then T1 and T2 are all going to stay within the thyroid gland for the most part. So looking at all of these hormones, again, I asked the same question: how can a medication that's a synthetic version of just T4 alone possibly kind of make up for all of these different hormones here? And the answer again is it can't, right? So if you want to get to the bottom of what's going on with your thyroid so that we can start to understand where we need to support to get back to normal, you've got to ask a couple different questions. First question is production issue. So do we have an actual production issue where we're simply just not producing enough hormone? So you're not making enough. That's the only issue that's going to be solved by actually taking a medication. The second thing we want to look at is, do we have a conversion issue? So we talked about how T4 is the main hormone produced by the thyroid. T3 is actually the most bioavailable and most active form, so the body has to convert T4 into T3, and that conversion happens in a couple different places in the body. So even if we're producing enough, if we're not converting that hormone, then we're not going to be able to actually have the effect on the cells, so we may still have all the same symptoms. Is there a destruction issue? So this is looking at, is there an autoimmune problem? Is there cancer? Do we have nodules forming? Things like that. And a lot of times that destruction issue is where we may see some of those red flags pop up. But in most situations, the people coming into our offices have been dealing with this for years. They've seen the medical doctors. They've gone through all the testing. They've done all the things. And they know they don't have a destruction or they don't have any red flags. But they're still just being drug down the same path and not getting answers. So A lot of times, though, we do have to rule out red flags in that destruction area there. And then do we have an interference issue? So what is triggering it? Are there hormonal issues? Are there gut health issues? Are there liver issues? Is there a toxicity issue? And that's really where the fun comes in, because we can really start to put together the different pieces of the puzzle. So what does it look like to have a production issue? So that, again, this is going to be the only issue that you're actually going to feel a significant improvement by taking the medication. Your body's not producing enough T4. We give your body T4, everything else is working right, and you feel better, right? It's pretty simple. What that's going to look like on blood work is we're going to have that high TSH level because the body's trying to stimulate that feedback loop, trying to produce more, so TSH is climbing. But because we can't produce it, we're going to have a low T4. If they tested your T3, this could be normal or it could be abnormal, or there could be other variations of that we can see on blood work. But typically, the normal hypothyroidism production issue is going to be a high TSH and a low T4. Now, what's going to cause issues like this? Well, we can't produce something if we don't have the building blocks, right? So we have to make sure we have all of the nutrients, all the things in the thyroid that we need. So it's important that we have iron, iodine, tyrosine, zinc, selenium, vitamins E, B, C, and D. Now, could there be another issue interfering with this? Yeah, 100%. So say we don't have enough absorption in the gut of vitamin B. Well, if we can't absorb and utilize vitamin B, we're going to be deficient of that in the thyroid. We're going to have a production issue with the thyroid. We can give you a lot more vitamin B, but the answer is still that we have a gut issue going on where we're not absorbing it. So we still have to correct the underlying gut issue if we're ever going to be able to stand on our own and have normal thyroid function. So that's why it gets a little bit more complicated than just a straightforward production issue. But that's also where the fun comes in, because we can really start to dive into what's actually going on. So how do we make thyroid hormone? If we want to know if we have a production issue, we got to understand kind of how the production of thyroid hormone happens. And it all starts with an amino acid called tyrosine. So tyrosine looks kind of like this. The first thing that we're going to do is we're going to bring iodine into the thyroid. So we have an iodine symporter, we bring iodine into the thyroid, and when the thyroid is heavily trying to produce hormone, that iodine can actually be concentrated up to 250 times the normal blood amount. So the thyroid is going to hold a lot of iodine. Now we're going to take an iodine molecule, we have an enzyme that's going to bind that iodine onto a tyrosine molecule. So we talked about our main thyroid hormones being T1, T2, T3, T4, and reverse T3. So looking at this, we have a tyrosine molecule, that's where the T comes from, and the 1 stands for having 1 iodine bound to that tyrosine molecule. So this is T1. In order to get to T4, we then have to add another iodine molecule, and that's going to give us T2. Now from here, what you may be thinking is that we'll probably just plop another couple iodines on there, call it a day, have T3 and T4. But that's not the way it works. The next step is we're going to take 2 of our T2 molecules and we're going to actually bind them together to create T4. This is where most of the storage of thyroid hormone in the thyroid actually happens. It's unbound from the thyroglobulin molecule and then it's released into circulation, for the most part like T4. This next process here of converting into T3 happens mainly in the body in peripheral circulation, where we remove an iodine molecule and now we have T3. Now the shape of this molecule right here, I always say it's kind of like a key. The cells on the body that respond to thyroid hormone are like the lock. There's one lock, one key for every lock. If the key doesn't fit the lock, we're not going to be able to open the receptor, right? So what happens is under times of very extreme stress, the body has a protective mechanism where we actually remove a different iodine molecule. The lock, or the key, no longer looks the same. It doesn't unlock that receptor, and now we're going to downregulate that thyroid production, right? So that's going to be called reverse T3. So what is tyrosine? Well, tyrosine is a non-essential amino acid. It means you don't have to get it from your diet. It comes from the Greek word meaning tyros, which means cheese. So if we're deficient in tyrosine, we've got to be able to get more of that in our diet. The best places to find tyrosine are going to be chicken, turkey, fish, peanuts, almonds, avocados, bananas, milk, cheese, yogurt, cottage cheese, lima beans, pumpkin seeds, and sesame seeds. Now, are all of these things healthy for you? No. Am I recommending that you go out and eat a bunch of cottage cheese just because you think you may be low in tyrosine? Absolutely not, right? So we have to be smart about this. We have to make good choices with where we're getting this tyrosine from. But it is important to be mixing these things into your diet on a regular basis to make sure that you have enough of those precursors. How about iodine? Well, if we have a deficiency in iodine, we can't make thyroid hormone. It's very simple. And this is one of the largest causes of hypothyroidism in the world. Now, not necessarily in the US, but definitely in the world, iodine deficiency is a huge problem. If we can't get enough iodine or don't have enough, a lot of times we're going to get that goiter, that swelling in the front of the neck. And again, we don't see this that much in the United States. But where can we get iodine? Well, iodine comes for the most part from the sea. So seafood, sea salt, sea vegetables, and then things like cranberries, strawberries, egg, turkey, prunes. So there's a lot of other places to get it as well. But it's estimated that a very large percentage of the world is deficient in iodine. Now, I'm going to talk about this a little bit later. I don't want you to just go run out and buy iodine and start taking a lot of iodine, because if we're low in thyroid production, thyroid hormone production, and we start increasing that, one of the cool things about the thyroid producing thyroid hormone is it creates a lot of free radicals, which can create damage to surrounding tissue. So if we are low and we're not producing a lot, and we take a bunch of iodine and we start producing a lot, we're going to create a lot of free radicals. And if we don't have antioxidants in the body, specifically things like selenium, we're going to create a lot of damage. So I don't ever give anybody iodine without also giving them selenium, things like glutathione, to make sure that we're going to be able to detoxify and clear out those free radicals as they're being produced to protect the body. So there's a lot of caveats to this stuff. So if you have questions about this, feel free to please reach out, leave a comment on the video, and I'll be more than happy to answer any of those questions for you. So what's this look like on blood work? Well, a production issue, we're going to have a high level of TSH. So that TSH right there at 4.07. Now, this is another thing, kind of like what we talked about before, is that the medical system won't treat you unless something is in the disease range. It has to be in the red, above or below the range. If it's not, then we'll just wait till it gets worse, or there's nothing wrong with you, or the symptoms are all in your head. And I know, unfortunately, a lot of you have been through that in the past. And this is a perfect example of someone who had all the symptoms, but their TSH wasn't in the red. 4.2 is the upper limit. They were at 4.07. Now, are they trending in that direction? Yes. Are they almost on the edge? Yes. Is there anything that can be done for them from the medical standpoint? No, because you can't prescribe a medication for someone who doesn't have a diagnosis, and you can't diagnose someone with something that's not outside the diagnostic range. So TSH on the way high end of the range. Total T4 production here should be somewhere between 5.1 and 14.1, and they're at 6.4. So our TSH is on the high end of the range. T4 is on the low end of the range. Functionally, this patient is hypothyroid, so we need to work to produce more hormone in this case. Question number 2, do we have a conversion issue? So this is where we talked about 93% of the hormone released from the thyroid gland is T4. T4 is not the active hormone. T3 is the active hormone. So that means we have to get into the tissue and convert T4 into T3. What this can look like on blood work is we can have a low, or we can actually have a normal T4. So this is someone that may have had TSH and T4 run, and they were normal, and they were told they were fine, even though T3 is just tanked out because we can't actually convert any of that. There's a couple reasons for that. So we can be deficient in the cofactors like zinc, selenium, B vitamins, and glutathione that we need to actually make that conversion process happen. Or we could have imbalances in the areas that conversion takes place, the gut, the liver, the kidneys, skeletal muscle, things like that. If there's issues in those systems and we can't convert appropriately, again, that conversion process is going to be slowed down. Or we can have what we see on a really, really regular basis is stress, and cortisol is an issue. So we talked about thyroid hormone increasing metabolism. Thyroid hormone is going to bring you up like this. And so think about what else does that. The stress does that. So if we're constantly in this stressed out fight or flight, constantly up here, your body is really smart. It doesn't want two things taking us up at the same time. So it's going to actually convert T4 into reverse T3 instead of regular T3. That's going to deactivate that thyroid hormone. So it may look like we only have or like we're very low in thyroid hormone, but it's because we're actually converting into reverse T3. So I see this all the time. T3 is super low, but reverse T3 is sky high, and then I know it's actually a stress issue. And if we can't calm that stress response down, we're just going to hurt the patient and not be able to actually correct anything. These are the types of people that actually get worse when they take that medication, because that T4 just floods into T3. The body's trying to convert into reverse T3 to protect itself, and you're basically just overriding that protective mechanism, and these patients a lot of times will get worse when they take that medication. What this looks like on labs. So we've got T3, super low here. We've got T4 is actually high and TSH is low. So if we just looked at T4 and TSH, it's going to look like we actually have hyperthyroidism. The problem is that the body's trying to produce more T4 to convert into T3, because from a functional standpoint we're low, but we can't get that conversion to happen. So we just keep backfilling into T4. So in this case, we need to look at why is that conversion pathway not happening appropriately. Third one here is a destruction issue. So what this looks like is this is going to be your patient that has antibodies. Now, a lot of times antibodies don't get run right away by your traditional doctor because there's nothing that they are going to do for the autoimmune condition. They're still going to give you the levothyroxine and the Synthroid. Typically, what we're going to see is Hashimoto's. So Hashimoto's is thyroid antibodies with hypothyroidism. If we have thyroid antibodies with hyperthyroidism, that's going to be Graves' disease. So we can check TPO or thyroid peroxidase antibodies, thyroglobulin antibodies. We can also check thyroid stimulating immunoglobulin. So that's an antibody that actually binds to the cells and acts like thyroid hormone. So it'll stimulate your thyroid or stimulate your body outside of that normal feedback loop. So all these things we can check for on blood work. We also start with x-rays for all of our patients that come into the office, and we can actually start to see if there's calcification taking place on the thyroid, so we can get an understanding of what type of nodules may be forming there, what type of inflammation or destruction is taking place just by looking at a simple x-ray. And then we can have cancer, we can have nodules, things like that. And a lot of times we will palpate the thyroid if we feel stuff in there, and the labs don't really make sense. We'll send out for ultrasounds, things like that, again, to rule out any of those red flags. But possible causes here, Hashimoto's, Graves', and immune system issues. So this is where the key here is that if this is an autoimmune condition, it's not a thyroid problem primarily. Your thyroid is the target of the immune system. So we have to work on the immune system, calming down that immune response so that we can then get that barrage and attack on the thyroid to calm down at the same time. So these get more complicated, but we can make great strides in immune system cases. And patients get tremendously better when we start working with them because we can start to identify what those immune triggers are, remove them, and then that immune stimulation calms down, antibodies level comes back down, thyroid production, conversion all starts to happen at a normal rate again. So looking here, autoimmune conditions are actually a leading cause of death among young and middle-aged women. And so this may sound a little bit surprising, but the key here is that with this study, what they actually did was they compiled all of the autoimmune conditions together instead of breaking them out separately. So when we look at all-cause mortality, we want to know if you died from a heart attack, from a stroke, from cancer, from diabetes. We don't want to look at did we die from cardiovascular disease as a whole. We're looking at heart attack, stroke, congestive heart failure separately, right? So if we're looking at just Hashimoto's or just Graves' or just rheumatoid arthritis or just multiple sclerosis, it's not a big enough population of people that are dying from that to be put into that category. But when we mix all of those autoimmune conditions together, it actually breaks into the top 10 leading causes of death for that young and middle-aged women category. So autoimmune conditions are a huge issue in the United States. So again, this is a triggering of the immune system resulting in destruction of the thyroid, not a primary thyroid issue. And what this a lot of times will look like on testing is we're going to see any number of things happening up in here, but we're going to see thyroid peroxidase antibodies and thyroglobulin antibodies. Typically, we'll see both of those. Now, this is a patient that I saw in the office. She came in December of 2022, and when she came in, she actually came in for cardiovascular issues. She had a cholesterol level of like 300. Her triglycerides were crazy high, and she came in for that. We started talking. Turns out she's been taking thyroid medication for a long time. We ran a baseline thyroid panel to understand where her levels are at, and her thyroid peroxidase antibodies were at 9,800, almost 10,000. The reference range for this is below 60. So she should be below 60. She's at almost 10,000. We were working on this for a while. We retested in April of this year, and her thyroid antibody levels came down to 3,085 for thyroid peroxidase levels. So 988 to 3,085. Her thyroid globulin levels came from 290 to 185. So in just 5 months, she got cut almost in 2/3. We just reran testing again a week or two ago, and her thyroid peroxidase levels came down even more to 1,400. So she's making significant strides. Now, does she feel way better? Yeah, she feels awesome. She's sleeping better, she's losing weight, her hair is better, her skin is better, her mood and her energy are better. So she's on the right track, but even at 3,000, is she out of the woods yet? No, she's still way higher than where she should be, about 50 times higher still than that upper limit. So we still have a lot of work to do. This is a process that takes time, but we can absolutely make changes like this if we can start getting things in that immune system calmed down. Last question is, do we have an interference issue? So looking at interference here, there's a lot of different factors that can interfere, and interference issues can show up at any point during that thyroid. So we can have an interference issue like I talked about before, causing a production issue. If we have gut imbalances and we're not absorbing things like we should be, that's going to interfere with our ability to produce because we're going to be short on building blocks. We can have interference with things like stress that are causing a conversion issue. We can have things stimulating the immune system that are interfering with the body's ability to produce thyroid hormone because we're destroying the gland. So these issues can happen all over the place. Most common things we typically see coming with interference is going to be nutrition and stress. This is where we also start to see heavy metal toxicity, mold toxicity, food allergies. That patient I just talked about with her thyroid antibodies heavily related to her food allergies. Viral load from previous viral infections, gut issues, immune system issues, molecular mimicry. That's what that reverse T3, the thyroid stimulating immunoglobulin, all molecular mimicry. Hormone imbalances, pituitary dysfunction. So there's all sorts of things that can fall into this category. And again, this is where the fun is at, because this is where we get to start just digging down into things. This is why we have such a long 45-minute conversation when we first start care, because we're already trying to dive into all these different systems to try to understand where these dysfunctions may be coming from. So, what does an interference issue look like on blood work? Well, it could look like anything. And if you're seeing labs that are all over the place, chances are there's an interference issue going on. So that's what this patient had. You can see their blood work is just all over the place. So let's start diving into what makes up these interference issues. To start, we're going to look at kind of heavy metals and what can block the absorption of iodine. So if anybody has PTSD looking at the periodic table of elements here, I don't blame you. It's scary if you had to memorize it in high school or college. So if you remember, we break things up into categories on the periodic table of elements. This column right here is called the halide group. So the halides are going to be consisting of fluorine, chlorine, bromine, iodine, astaxanthin. So what these are here is just different elements, right? So you can see iodine is right here. We've got bromine, chlorine, and fluorine all sitting on top of iodine. And because they're higher up on the periodic table of elements, what that means is that there's going to be a higher affinity for these to be bound to thyroid or to tyrosine in the thyroid and to be absorbed by the thyroid than iodine. So if we have a lot of these things circulating within the body, that's going to take up space in that thyroid, and we're going to start to create more hormonal imbalances as a result of that. So we're going to block that iodine usage. So if we want to have healthy production of thyroid hormone, we have to be able to uptake and utilize iodine and not be uptaking things like fluorine in place of iodine, because if we have a T4 with tyrosine bound to 3 iodines and 1 fluoride, that's not going to work the same way as T4 with 4 iodine molecules. So we can't have a ton of this stuff circulating and expect to have normal function within the thyroid gland. The other thing we see a lot of is that your body will take up things like this, and it'll actually store it in fat tissue to get it out of circulation as a protective mechanism. The thyroid is a very fatty gland. It's also right in the neck, so it's a first place of circulation for things that are being absorbed into the bloodstream through the mouth. So things like toothpaste, if we're constantly absorbing a lot of that fluoride in the toothpaste, it may be getting stored in that thyroid gland there. Now, normal thyroid tissue does not contain fluoride. If it starts to contain fluoride, it's normal for your body to then go and say, hey, this cell is not a normal cell because normal cells don't have fluoride, this cell does, and we're going to trigger an immune response to that, and then we start creating autoimmune conditions and things like that because the immune system isn't making a mistake. Your immune system is recognizing that this tissue is not healthy. This is not what healthy tissue looks like. I'm going to dive all into that in an autoimmune talk that you can find separately. But for now, we just need to understand that these elements getting absorbed into the thyroid can create a lot of different issues in a couple different ways. So if we want to start working on avoiding things like fluoride, well, where do we get it from? Most common is going to be coming from toothpaste. So your fluoridated toothpaste. If you ever look at the back of a Colgate or a Crest toothpaste bottle, you'll see it says, if swallowed, please call poison control. Now, I don't know about you, but I don't want to be ingesting things that are poisonous. Now, is it going to kill you if you swallow a little bit? No. But are we only swallowing a little bit of it and then we're never touching it again? No. What's happening is we're brushing our teeth with the same thing every day, hopefully twice a day every day, for hopefully our entire lifetime. And so it's not that the amount of fluoride contained in one single toothbrushing of toothpaste is going to cause an issue. It's that we're doing this repetitively for our whole life. And there's other places that we get it from too. So we're constantly bombarding ourselves with these chemicals. Teflon coated nonstick pans. How many people like scraping food off their pans? No, no one likes to do that. So that's why we have that Teflon coating. But if you heat that up, if you scratch it, it's going to start to leach into your food, and you may be getting Teflon and fluoride in your food and ingesting that. How about Prozac, Paxil, SSRIs? What was one of the symptoms of hypothyroidism? Depression. What do we get put on for depression? SSRIs. If we have fluoride in our SSRI, which is going to block iodine absorption and utilization in the thyroid, and the thyroid being the reason that we have depression, are we going to just be stuck in an endless cycle? Yes. So this is why we have to really kind of get to the bottom of things. If you're depressed and you're not taking an SSRI, what might you also be doing? Drinking a bunch of wine. Well, did you know that wineries use fluoride-based pesticides in their vineyards? So if you're not buying organic wine, you could also be getting exposed through that as well. How about bromine? Bromine. Bromine is the bully of the halide group. This one we don't typically think about that much outside of brominated pools. So a lot of people, and when I was growing up, we had a hot tub in the backyard in Ohio. I was in it all the time in the winter, so for 4 or 5 months a year. And my parents didn't want to use a chlorine pool because we know chlorine's not good for you, so we were using bromine instead. But is bromine any better? And the answer is no. Unfortunately, it's not. So if you're constantly swimming in those chemicals, breathing them in, getting absorbed in your throat, straight into the thyroid, we're going to start to have a lot of issues. Chlorine is terrible. We know there's a lot of issues with chlorine. We use it because it's very good at killing things like in our drinking water, in our swimming pools, things like that. But if you're drinking the tap water at your house, you could be drinking a seriously high amount of chlorine. When my wife and I moved into our new construction home, we had the water tested as soon as we moved in. The guy who came out and tested the water told us that the water coming out of our faucet had twice as much chlorine as the legal limit in a swimming pool. And we were drinking that, we were showering in that, we were using that for cooking. So if you don't get a whole house water filtration unit, or at least a unit to go under your sink for your drinking water, a shower filtration unit for the water that you bathe in, you could be exposing yourself all over the place there as well. And if you need help trying to find any of these resources, reach out to us because we have tons of resources and information to help get you started on removing some of these chemicals. Next one is mercury, so looking at heavy metals. So it's known, there's research out there that talks about how mercury toxicity can actually block the absorption of iodine into the thyroid. So we have mercury circulating through the blood. We know we're not going to be able to absorb that iodine. We're going to create a production issue as a result of that. So how about the mercury that comes in your amalgam fillings? Did you know that that mercury can actually leach out and you can absorb it? That's what this video right here is. It's called the smoking tooth. So this is a tooth that was extracted that had an amalgam filling in it. And what this guy basically does is he takes a pencil eraser and he rubs the end of that tooth like he's doing right there. And what you see, that's basically stimulating the friction from eating food. And you can see the mercury vapor coming off of that tooth from the amalgam filling. So they tell you that those are safe to have in your mouth. I would argue that they're not. And every time you eat something hot or chew or bite down, you're going to be leaching that mercury vapor into your mouth. And again, there are negative associations observed between mercury and thyroid hormone levels, consistent with proposed mechanisms for mercury toxicity, in which mercury accumulates in the thyroid and reduces the iodide uptake at the sodium iodide symporter by binding to iodide. Do we want that in our body? No. If you remember from before, I talked about how I don't ever give iodine without also giving selenium at the same time, because selenium is so important for neutralizing the free radicals that are produced during thyroid hormone production. Mercury also impairs selenium activity. So if we're creating damaging free radicals and we need selenium in order to clear those out, and mercury is going to impair that, then it stands to also reason that we could be creating a destruction issue within the thyroid because we can't eliminate free radicals. So again, lots of reasons to ignore mercury. How about viral infections? We know that viral infections can lay dormant within the body. Typically, the immune system is strong enough to keep those suppressed. Well, what happens when a huge stress comes along, like COVID, like a divorce, like a death in the family, like a car accident, like any major stressful event in your life? That weakens that immune response, and now that virus that the immune system was able to keep dormant rises back up to the surface. Well, if the immune system doesn't respond enough to knock that back down, we're going to start to see all sorts of issues as a result of that. And that's what this patient was dealing with. They had thyroid peroxidase antibodies down here, so they had an autoimmune condition, and they had chronic Epstein-Barr virus that was constantly activating that immune system, and now we created an autoimmune condition as a result of that. Can we ever fix this if we don't get these viral infections to get knocked back down? And the answer is no. So again, we could just be banging our heads against the wall, wondering why nothing we're doing is working. It's not that it's not working, it's just that we're missing a piece of the puzzle. How about looking at cortisol? Did you know that it's contraindicated, directly contraindicated to give somebody levothyroxine if you have uncorrected adrenal insufficiency? How many people have ever been put on levothyroxine or Synthroid and not had their adrenal glands checked? Almost everybody, because nobody looks at your adrenal function. How many people here experience at least a little bit of stress, at least every now and again? And I would feel pretty comfortable saying every single one of you. So if you have not had your adrenal hormones checked, very important, and we can check that. So cortisol is produced by the adrenal glands. Cortisol increases in the morning. That's what gets you up, gets you energy, gets you moving, and then gradually decreases throughout the day and helps you fall asleep. So what this looks like is we should fall somewhere between this pattern right here. As you can see, that comes down throughout the day. What chronic stress looks like is way up here. So this is someone who's just constantly stressed out. This is the wired but tired feeling. And if we're constantly stressed for our entire lives, eventually we're going to wear down and fatigue those adrenal glands out, and we're going to end up down in here, where we just have no ability to continue producing hormones. And those are the patients I describe as being so tired that they just can't fall asleep. So if that sounds like you, chances are there's a big time adrenal issue going on, and that could be directly affecting your thyroid hormones. What this looks like on blood work through a Dutch test is someone who's here, really high cortisol levels in the morning, and then they just tank. So this is someone who gets up and feels fine for the first couple hours of the day, and then by the end of the morning they are just flat and they are tanked through the entire rest of the day. And these are things that we can test again through a Dutch test, which is one of the best tests that we use for testing female hormones in that excretion pathway. That's what this test right here is. So if we have really high levels of estrogen, that's also going to affect the utilization of thyroid hormone within the body. So it could be that we have enough production and enough conversion going on, but we have estrogen molecules that are binding up that thyroid hormone or that are blocking the receptor sites for the thyroid hormone. And even though we have enough of it, even though we look fine on labs, we feel terrible because we can't actually utilize any of that. And a lot of times that's a hormonal issue. We talked about heavy periods, really light periods, painful clotting, things like that, also related to hormones. So for females especially, females are affected by thyroid dysfunction significantly more than men are. And one of the main reasons is because of the interaction between estrogens and your thyroid hormones. So if you have not had your hormones tested, getting that looked at the same time you look at thyroid hormones is super important. We look at what triggers the immune response. So there's a lot of things that can trigger that immune response. We talked about the viral infections triggering the immune response. How about foods? We eat food all day long. If we have antibodies to the food that we're eating, it means that every time we eat that food, it's going to trigger an antibody response. It's going to create cellular damage. It's going to create an inflammatory response. It's going to trigger the immune system. And if we're doing that day in, day out with every meal, every time we eat, we're eventually going to lead to immune system dysfunction. And that's what we look at with food allergy testing. Traditional food allergies are these IgEs. These are the fires, the histamine, the anaphylactic responses. Those make up less than 1% of the immune system. Most people don't have those. If they do, they typically know because they were tested, or they ate a food, they responded terribly to it, and they just don't eat it. In our office, we focus more on IgG testing, typically referred to as a hypersensitivity or an intolerance. What these are going to show us are delayed food responses. So you don't have the immediate anaphylactic reaction. They're not going to kill you. But again, every time we eat this food, it creates cellular damage, creates an inflammatory response, triggers the immune system, and oh, by the way, it makes up 70% of the immune response. So we respond to significantly more foods. If you look at what that looks like, this was my food allergy test when I had 29 food allergies. So barley, cashew nut, coconut, garlic, kale, lettuce, peanut, perch, pineapple, rice, brewer's yeast, wheat. So there's a lot of things on that list that would normally be healthy, right? Hemp seeds. People add hemp seeds to things all the time because they think they're healthy. But in my case, hemp seeds, not healthy. So we don't talk about diets typically. We want to just go on anti-inflammatory diets. We want to avoid things that are going to trigger an inflammatory response. And from here, we can build. Now the key is we can't heal the body if we're constantly putting stress on it. So step one, figure out what is stressing the body, remove it, and then give the body what it needs to heal, and your body can adapt and change to that. So these are my food allergies when I tested them in April of 2022. You can see right there. These are my food allergies when I tested them in August of 2023, 29 to 6. And the reason for that is because I healed my gut. And this is a big indicator of functional improvement within the body. Now, I don't have a thyroid issue, but it doesn't mean that I can just deal and continue living like this and expect to not have issues in the future. So this is a perfect example of someone who's generally pretty healthy, doesn't have a lot of issues going on, but I'm creating a ton of inflammation through my diet. So if I can work to heal those things now, reduce this, reduce the amount of leaky gut I have going on, I know I'm going to be avoiding chronic conditions in the future, and that's my main goal. So we talk about leaky gut, things like stress, toxins, food particles, drugs, pathogens, organ malfunction. So many people are acknowledging nowadays that leaky gut is the precursor for all autoimmune conditions. So if we know we're eating foods that are triggering an immune system, that are creating cellular damage, that are creating leaky gut, we're going to end up with these immune system issues in the future, which is why it's so important. So the first thing that we need to do is we need to take a look at what your gut actually looks like. And the easiest and first place to do that is actually just by looking at an x-ray. So on x-rays, we're looking mostly for bone, but we can see soft tissue in here as well. And you can see a lot of that inflammation and bloating and gas. You can see this is a patient with very little fat, but their belly is just being pushed out by the constant bloating. And that does get very discomforting and very painful. We have patients that come in all the time with swollen guts because of all the inflammation they're triggering. And those are things that can be healed by looking at food allergies. So once we've kind of narrowed down where the issues might be coming from, how do we actually measure where your thyroid is at? So first thing is TSH. TSH is not actually a thyroid hormone. It's produced in the pituitary gland, if you remember. It just stimulates the thyroid to release thyroid hormone. So it's a very important marker. I know I talked bad about just measuring TSH in the past, but TSH is very important. You have to know where your TSH is at. We also want to know where your total T3 and T4 is. So total is the amount that's being produced within the body. And we want to know where your free T3 and T4 is. So free T3 and T4 are what's actually available to be converted and utilized within the cells. Reverse T3, we want to know if there's a protective mechanism going on. This is a conversion issue here. Resin T3 uptake is a super cool hormone that can tell us how many binding sites are available. So it doesn't matter how much thyroid hormone we're producing. If you have something like estrogen going in and blocking binding sites, we can produce all the hormone in the world. It's not going to make a difference because it can't actually access the cells and access those binding sites. So resin T3 uptake can tell us what that looks like. Thyroid binding globulin. We produce the thyroid hormones in the thyroid, but then they act on every cell in our body. So we have to get from point A to point B, and that's where thyroid binding globulin comes into play. That is a transport hormone. We have our thyroid antibodies, TPO, our thyroid peroxidase antibodies, anti-thyroglobulin antibodies, and then I talked again about thyroid stimulating immunoglobulins, which are not on here, but we can test those as well. Cortisol, very important to test cortisol so we have an understanding of what that stress response looks like. Ferritin, which is our protein storage of iron. This is giving us an indication of what the liver is doing for storage. Vitamin D, it's estimated that 92% of people with Hashimoto's have a vitamin D level under 30. Ideally, I want that vitamin D level 80 to 100. Vitamin D, very important for immune system regulation, specifically with T regulatory cells, which has to do with autoimmune conditions. Again, I have an autoimmune talk. If you would like to see that talk, you can find it. You can reach out if you can't find it, but I go much more in depth into that. So again, I ask you, if you want to understand what's going on with your thyroid, you've got 4 main questions you've got to ask. Is it a production issue? Are we making enough hormone? Is it a conversion issue? Are we converting T4 into T3 appropriately? Is there a destruction issue? Is something physically damaging the thyroid? Or do we have an interference issue which can affect any one of those other systems? So if you stuck around this long, I thank you. I hope you didn't fall asleep. If you want to connect more with us, you can visit thewellnessway.com. You can also visit twwsarasota.com. I'll have all those links in the comments below. If you're not a patient and you sat through this entire talk and you'd like to get started, you can do that. We are running a new patient special for anybody who watches this talk for $99. That is going to include a review of your past test results. It's going to include that 45-minute consultation I talked about. If you're local to the area, it will also include x-rays. And then from that point, we'll make any recommendations from further testing that we may need to start getting a better understanding of what's actually going on so that we can start to move forward in the right direction. So again, thank you. I hope you learned at least a little bit from the talk tonight, and I wish you all well.